If you've ever woken up and your mouth felt completely dry, your lips cracked, your tongue almost sticking to the roof of your mouth, and the first thing you had to do was reach for water. You probably didn't think much of it. Maybe you figured you didn't drink enough water before bed. Maybe the air in your room was dry. Maybe you were breathing through your mouth while you slept. And honestly, any of those things could be the reason. Most of the time, waking up with a dry mouth is completely harmless. It happens to almost everyone at some point, and usually it passes as soon as you hydrate. But here's where it gets interesting. When that dryness starts showing up night after night, when your lips feel constantly chapped no matter how much water you drink or how much lip balm you apply, when it starts to feel less like a one-time thing and more like a pattern, that might be a quiet signal from your body that something else is going on. And no, that doesn't mean something terrible is happening. It just means it could be worth paying a little closer attention. Because your body has a way of sending messages, and sometimes the messages start small. A dry mouth here. A scratchy throat there. A feeling that something just isn't quite the same as it used to be. In this video we're going to walk through what dry mouth actually means on a biological level, what the most common causes are, the ones most people never even consider, and when persistent dryness might be connected to something worth discussing with a doctor. We'll also talk about a condition called Sjogren syndrome, which is one possible explanation among many, and go through several related symptoms that, when they show up together, can paint a clearer picture of what your body might be trying to communicate. This isn't about jumping to conclusions. It's about understanding your body just a little bit better. So let's start with the basics. What's actually happening when your mouth feels dry? Your mouth has several salivary glands. The major ones sit near your jaw and under your tongue. There are 3 pairs of major glands: the parotid glands near your ears, the submandibular glands under your jaw, and the sublingual glands beneath your tongue. On top of those, you have hundreds of tiny minor salivary glands scattered throughout the lining of your mouth and throat. Together, they produce somewhere around half a liter to a full liter and a half of saliva every single day. That might sound like a lot. But saliva does way more than you probably realize. It's one of those things you never think about until it's not working properly. First, it's the very beginning of your digestion. Saliva contains enzymes, particularly one called amylase, that start breaking down starches and food the moment it enters your mouth. Without enough of it, digestion becomes harder right from the start. Food doesn't break down as efficiently, and your stomach has to work harder to compensate. Second, saliva protects your teeth and gums. It constantly washes away food particles, neutralizes acids produced by bacteria, and delivers calcium and phosphate minerals that help keep your enamel strong and resistant to decay. When saliva production drops, the risk of cavities, gum disease, and even oral infections goes up significantly. Your mouth essentially loses its built-in cleaning system. Third, saliva helps you speak and swallow comfortably. It's basically the lubrication system for your entire mouth and throat. Try talking for 10 minutes with a completely dry mouth and you'll understand just how essential that moisture is. It also plays a role in taste because your taste buds need saliva to dissolve food molecules and carry them to the receptors on your tongue. Fourth, and this one often surprises people, saliva contains antimicrobial compounds that help fight off bacteria, viruses, and fungi. It's part of your immune defense at the very entry point of your body. When you don't have enough saliva, you're not just uncomfortable, you're also more vulnerable to infections in your mouth and throat. When your body isn't producing enough saliva, a condition that doctors sometimes refer to as xerostomia, you start to feel that sticky, parched sensation. Your lips may crack. Swallowing can feel awkward. Your throat may feel scratchy. Food may not taste quite the same. You might notice bad breath that doesn't seem to go away even after brushing. And in some cases, you might develop sores or a burning sensation on your tongue. Now, the key question is, why is saliva production dropping in the first place? And that's where things get layered. Because there are a lot of possible answers. Some of them are simple and easy to fix. Others require a closer look. Before we talk about anything medical, let's go through the everyday causes of dry mouth. These are the ones that affect the most people and they're worth checking off before looking any deeper. You might be surprised by how many of these apply to your daily life without you even realizing it. Dehydration. This one sounds obvious, but it's more common than you'd think. A lot of people simply don't drink enough water during the day, especially in the hours before bed. If your body is even mildly dehydrated, one of the first places you'll notice it is your mouth. And mild dehydration is far more common than most people assume. You don't have to be stranded in a desert to be dehydrated. Simply not replacing the water you lose through breathing, sweating, and normal bodily functions throughout the day is enough. Coffee, alcohol, and certain teas can also contribute to dehydration because they act as mild diuretics, meaning they encourage your body to expel more water than usual. So if your evening routine involves a glass of wine or a cup of coffee after dinner, that could be a factor worth considering. Even things like high-sodium meals can shift your body's fluid balance and leave you feeling drier than expected. Mouth breathing. If you breathe through your mouth while you sleep, and a surprising number of people do, the air flowing over your tongue and palate dries out the tissue. You wake up feeling like your mouth is made of sandpaper. It's one of the most common reasons for morning dry mouth, and many people have no idea they're doing it. Mouth breathing at night can be caused by nasal congestion, seasonal allergies, a deviated septum, enlarged tonsils or adenoids, or even just sleeping position. Sleeping on your back, for example, makes it more likely that your jaw will fall open during the night. Some people only mouth breathe when they have a cold, while others do it year-round without ever knowing. If you often wake up with a dry mouth and your partner tells you that you snore, mouth breathing is very likely part of the equation. Medications. This is a big one, and it's one that deserves real attention. Hundreds of medications list dry mouth as a side effect. Antihistamines, antidepressants, blood pressure medications, decongestants, muscle relaxants, anti-anxiety medications, and pain medications can all reduce saliva production. Some estimates suggest that over 400 commonly prescribed drugs have dry mouth as a known side effect. If you started noticing dry mouth around the time you began a new medication, that's one of the first things to mention to your doctor or pharmacist. It doesn't necessarily mean you need to stop the medication, but there may be ways to manage the side effect, such as adjusting the dose, switching to an alternative, or using saliva-stimulating products. The important thing is not to suffer in silence or assume it's just something you have to live with. Sleep environment. The air in your bedroom makes a bigger difference than most people realize. If you sleep with a fan blowing directly on your face, or if the air in your home is dry, especially in winter when heating systems are running, that can pull moisture from your mouth and nasal passages while you sleep. Air conditioning in the summer can have a similar effect, as it removes humidity from the air. A simple hygrometer, which you can pick up for just a few dollars, can tell you the humidity level in your room. Ideally, you want it somewhere between 30 and 50%. If it's consistently below that, a humidifier might make a noticeable difference in how your mouth feels when you wake up. It's a small change that can have a surprisingly big impact. Caffeine and alcohol. We touched on this briefly with dehydration, but it's worth calling out on its own. Both caffeine and alcohol can reduce saliva production directly, on top of their dehydrating effects. Caffeine stimulates your nervous system in a way that can suppress salivary gland activity, and alcohol irritates the mucosal lining of your mouth while simultaneously pulling water from your tissues. If you consume a lot of either, especially later in the day, that's worth factoring in as a potential contributor. Tobacco use. Whether it's smoking or chewing tobacco, tobacco products can significantly reduce saliva flow and irritate the tissues in your mouth. Smoking in particular dries out the oral cavity and changes the composition of saliva, making it less effective at doing its protective jobs. If you use tobacco products and experience chronic dry mouth, that connection is well established. Aging. As we get older, saliva production naturally decreases for some people. This isn't the case for everyone, but it's a contributing factor that often gets overlooked. Combined with an increased use of medications as we age, and sometimes reduced fluid intake, it's easy to see how dry mouth becomes more common over time. It's not inevitable, but it is more prevalent in older adults. Now, if you've gone through this list and none of it fully explains what you're experiencing, or if you've tried addressing these factors and the dryness is still there, stubbornly persisting no matter what you do, that's when it might be worth looking a little further. Here's the thing about persistent dry mouth. On its own, it can be caused by many of the things we just discussed. But when it shows up alongside other symptoms, and especially when it doesn't go away despite your best efforts, it can sometimes be a sign that your body's immune system is behaving differently than it should. One condition where persistent dry mouth is a hallmark symptom is something called Sjogren syndrome. Sjogren's, pronounced Sjogren's, is an autoimmune condition. That means the body's immune system, which is supposed to protect you from infections and outside threats, mistakenly starts targeting your own tissues. Instead of attacking bacteria or viruses, it turns inward. In the case of Sjogren's, the immune system primarily attacks the glands that produce moisture, especially the salivary glands and the tear glands. That's why the two most common symptoms are dry mouth and dry eyes. The immune cells infiltrate these glands and interfere with their ability to produce the moisture your body needs. It's more common than most people realize. It affects millions of people worldwide, and it disproportionately affects women, who make up roughly 90% of those diagnosed. It can develop at any age, but it's most commonly diagnosed in people over 40. The average time to get a diagnosis is several years, partly because the symptoms are so easy to write off as just dry mouth or just tired eyes. People often go from doctor to doctor, treating each symptom individually, before someone connects the dots. Now, I want to be very clear about something. Having dry mouth does not mean you have Sjogren's. It doesn't even mean you're likely to have it. The vast majority of people who experience dry mouth will have a simpler explanation. But being aware that this condition exists and understanding the pattern of symptoms that sometimes goes along with it can help you have a more informed conversation with a healthcare provider if you ever feel like something is off. Knowledge doesn't have to create fear. It can create clarity. So let's walk through several symptoms that, when they cluster together, could be worth paying closer attention to. Remember, each of these symptoms has multiple possible causes. What matters most is the pattern. Symptom number 1. Dry eyes. Let's start with the one that pairs most closely with dry mouth. You know that gritty, stinging feeling you sometimes get when your eyes are tired? Most people have experienced it after staring at a screen for too long, or after a long flight or on a windy day. But for some people, that feeling is constant. Their eyes burn. They're red. They feel like there's sand stuck under the eyelids. And no amount of blinking seems to help. They might find themselves using eye drops multiple times a day just to get through their routine. Now, dry eyes on their own are incredibly common. Screen use, contact lenses, low humidity, aging, hormonal changes, and even certain medications like antihistamines and birth control can all cause them. So having dry eyes doesn't automatically point to anything specific. But when dry eyes and dry mouth show up together, and both are persistent, that combination starts to narrow the field. In Sjogren's, the immune system targets moisture-producing glands, and the tear glands, called the lacrimal glands, are right near the top of that list. The result is a chronic reduction in tear production that doesn't respond well to typical dry eye remedies. If this sounds familiar, an eye doctor can measure your tear production with a quick, painless test called a Schirmer's test. It involves placing a small strip of paper under your lower eyelid for a few minutes. It's one of the simplest ways to check whether your dryness has a measurable component, and it can provide useful information for your doctor. Symptom number 2. Persistent fatigue. Fatigue is one of the most common symptoms reported by people across all kinds of health conditions. And that's exactly what makes it tricky. Because tiredness can come from so many places. Poor sleep, stress, anemia, thyroid issues, depression, vitamin deficiencies, or simply not getting enough rest. The list is long. But the kind of fatigue we're talking about here goes deeper than normal tiredness. It's the kind where you've slept for 8 hours and still wake up feeling like you haven't rested at all. The kind where your body feels heavy, your motivation drops, and even simple tasks feel like they take more effort than they should. It's not laziness. It's not just being tired. It's a bone-deep exhaustion that doesn't improve with rest. In autoimmune conditions like Sjogren's, this type of fatigue is very common, and it's actually one of the symptoms that patients report as most affecting their quality of life. When the immune system is chronically active, even at a low level, it uses up a significant amount of the body's energy. It's like running an invisible program in the background that you can't close. Your body is fighting a battle you can't see, and it takes a toll. On its own, fatigue doesn't tell you much. But if it's showing up alongside persistent dryness, it's one more piece of the picture that's worth paying attention to. Symptom number 3. Joint pain or stiffness. Joint discomfort is another one that can come from many different directions. Overuse, age, injury, osteoarthritis, rheumatoid arthritis, or even changes in weather can all cause aches and stiffness. It's an incredibly common complaint, especially as people get into their 40s and beyond. But when people with Sjogren's experience joint symptoms, they often describe a particular pattern. It tends to show up in the smaller joints, hands, wrists, fingers, and sometimes the knees and ankles. It's often worse in the morning, sometimes taking an hour or more to loosen up. And it may come and go without a clear trigger, flaring up for days or weeks and then subsiding. This happens because autoimmune inflammation doesn't just stay in the glands. It can affect joints, tendons, and other connective tissues throughout the body. The inflammation may not cause the kind of joint damage seen in rheumatoid arthritis, but it can still be uncomfortable and disruptive to daily life. Again, joint stiffness by itself isn't unusual and has many causes. But when it starts showing up alongside dry mouth, dry eyes, and fatigue, the pattern becomes more meaningful. It adds another data point to the picture your body is painting. Symptom number 4. Difficulty swallowing. This is one of those symptoms that people often adjust to without realizing how much it's affecting them. They start drinking water with every meal. They avoid dry foods like bread, crackers, or rice. They clear their throat more often. They might even start cutting food into smaller pieces or chewing for longer without consciously deciding to. It becomes a habit before it becomes a concern. When saliva production drops significantly, swallowing can start to feel difficult or uncomfortable. Food can feel like it's sticking in your throat. Your throat might feel tight even when there's nothing physically blocking it. You might find yourself coughing during meals or needing to take extra sips of liquid to wash food down. Other things can cause difficulty swallowing too. Acid reflux is a common one, as is anxiety, thyroid issues, muscle tension in the neck, or even simple dehydration. So this is another symptom that means different things in different contexts. But in the context of significant, ongoing dry mouth, swallowing difficulty fits into the pattern. It's one of the downstream effects of having less lubrication in your mouth and throat, and it can be one of the more frustrating day-to-day consequences of reduced saliva production. Symptom number 5. Brain fog. Brain fog is a term that gets used a lot, and it can mean different things to different people. But generally, it describes a feeling of mental cloudiness. Trouble concentrating on tasks you normally handle easily. Forgetting words mid-sentence. Walking into a room and having no idea why you went there. Feeling like your thinking is slower, fuzzier, or less sharp than usual. It's not a medical diagnosis in itself, but it describes a real and sometimes debilitating experience. Brain fog can be caused by sleep deprivation, chronic stress, hormonal changes like menopause, dietary issues, blood sugar fluctuations, or even certain medications. So just like fatigue, it's not specific to any one condition. It's a symptom that shows up across a wide range of situations. But it's a well-documented experience among people with autoimmune conditions, including Sjogren's. Chronic inflammation and the body's constant immune response can affect cognitive function in subtle but very real ways. Researchers are still working to fully understand the mechanism, but the experience is consistently reported by patients and increasingly recognized by clinicians. If you're experiencing brain fog alongside the other symptoms we've talked about, it's worth noting. It's one more thread in the tapestry. And if it's affecting your work, your relationships, or your daily functioning, it absolutely deserves to be part of the conversation with your healthcare provider. Symptom number 6. Skin dryness. Our skin relies on moisture to stay flexible, resilient, and healthy. It's the largest organ in your body, and it needs adequate hydration from the inside and the outside to function well. When your body is dealing with systemic dryness, meaning dryness that goes beyond just your mouth or eyes, your skin can become noticeably drier, rougher, flakier, and more prone to irritation and itching. Dry skin is one of the most common complaints in dermatology, and it can be caused by climate, cold weather, hot showers, harsh soaps, eczema, psoriasis, or simply getting older. So on its own, it's usually not a red flag. Almost everyone deals with dry skin at some point. But here's the pattern question. Are you experiencing dryness in your mouth, your eyes, and your skin? If multiple areas of your body seem to be losing moisture at the same time, and the dryness doesn't respond well to typical moisturizers and remedies, that's a pattern that may point toward something systemic rather than something localized. It suggests that the issue might not be with any one area of your body, but with the systems that regulate moisture throughout your body. In Sjogren's, the immune system's attack on moisture-producing glands can ripple outward, affecting the skin, nasal passages, the vaginal lining, and even internal organs in more advanced cases. The dryness becomes a whole-body experience rather than isolated to one area. Symptom number 7. Dental problems that seem to come out of nowhere. This one often catches people by surprise, and it's frequently the symptom that eventually leads to a deeper investigation. You brush your teeth regularly. You floss. You go to the dentist for your checkups. You've always had reasonably good oral health. And yet suddenly you're getting cavities. Multiple cavities. In places where you've never had them before. Or your gums are inflamed and bleeding. Or you're dealing with fungal infections in your mouth like oral thrush, that never seemed to be a problem before. When saliva production drops, your mouth loses one of its most important defense mechanisms. Without enough saliva to wash away bacteria, neutralize the acids that bacteria produce, and deliver protective minerals to your enamel, your teeth and gums become much more vulnerable. The environment in your mouth shifts, and the organisms that cause decay and infection start to thrive. Dentists are sometimes the first healthcare providers to spot signs of conditions like Sjogren's, because the sudden increase in dental problems can be a visible clue that something has changed in the mouth's environment. A dentist who notices an unusual pattern of decay, especially along the gum line or on the root surfaces of teeth, may be the first person to suggest looking into why your saliva has changed. If your dentist has mentioned that your oral health has declined and they can't fully explain why, and you're also dealing with persistent dry mouth, that's absolutely worth bringing up in a conversation with your doctor. It's one of those connections that's easy to miss if no one is looking at the full picture. So how do you know when something is worth investigating further? Here are a few things to think about. Frequency. Is the dryness happening every day? Or is it occasional? If your mouth is dry every single morning, that's different from it happening once or twice after a late night out or after taking an antihistamine for allergies. Daily, recurring symptoms deserve more attention than one-off episodes. Consistency is a signal. Duration. How long has this been going on? If it's been a week or two, it might be related to something temporary like a medication change, a cold, or a period of high stress. But if it's been happening for weeks, months, or longer and nothing you've tried has made it go away, that's a different story. Persistent symptoms are one of the most important signals your body can give you. They're your body's way of saying this isn't going away on its own. Clusters. This is the big one. Are you experiencing more than one of the symptoms we've talked about? Dry mouth on its own has many explanations. But dry mouth plus dry eyes plus fatigue plus joint stiffness? That's a cluster. And clusters of symptoms are often what lead healthcare providers to look more carefully at what's going on beneath the surface. Individual symptoms are easy to explain away. Patterns are harder to ignore. One of the most practical things you can do is keep a simple symptom journal. It doesn't have to be anything fancy. A notes app on your phone works perfectly. Just jot down what you're noticing when it happens and how often. Note anything else that's going on, medications you're taking, how well you're sleeping, your stress levels, what you're eating and drinking, and whether symptoms seem better or worse at certain times of day. When you walk into a doctor's appointment with that kind of information, it makes a real difference. It gives them something concrete to work with, instead of trying to reconstruct everything from memory on the spot. It turns a vague "I've been feeling off" into a detailed picture that a doctor can actually use to guide their thinking. If you've made it this far in the video, you now have a much clearer picture of what dry mouth can mean, what the most common causes are, and when it might be worth digging deeper. Here's what I'd encourage you to take away from this. First, don't panic. Dry mouth is extremely common, and the vast majority of the time, it's caused by something simple and manageable. Dehydration, medications, mouth breathing, or your sleep environment are the most likely explanations. Start there. Second, pay attention to patterns. If the dryness is persistent, and especially if it comes with other symptoms like dry eyes, fatigue, joint stiffness, or unexplained dental problems, take note. Your body communicates through patterns, and being aware of them is one of the most empowering things you can do for your health. You don't need to be anxious about it. Just be observant. Third, talk to someone qualified. If something doesn't feel right, bring it up with your doctor. Mention the dryness, mention any other symptoms, and share any notes you've kept. You don't need to walk in with a self-diagnosis. You don't need to say, "I think I have Sjogren's." You just need to walk in with information and let your healthcare provider do what they're trained to do. A good doctor will listen, ask the right questions, and determine whether further testing makes sense. Conditions like Sjogren syndrome exist on a spectrum, and early awareness can make a meaningful difference in how they're managed. But there are also many other conditions that can cause similar symptom patterns, from thyroid disorders to medication side effects to other autoimmune conditions to hormonal changes and beyond. That's exactly why professional evaluation matters so much. A qualified healthcare provider can sort through the possibilities and get to the right answer for your specific body and your specific situation. Your body is always communicating with you. Sometimes it's loud and obvious. Sometimes it's quiet and subtle. A persistently dry mouth might be nothing more than a sign that you need to drink more water or adjust your sleep setup. Or it might be the beginning of an important conversation with your body that leads you to answers you didn't know you needed. Either way, noticing patterns in your body is one of the most useful steps you can take toward getting the right answers. If you found this helpful, consider leaving a like or sharing it with someone who might benefit. And if you want to learn more about listening to the signals your body sends, subscribe so you don't miss the next one. Thank you for watching. Take care of yourself, and I'll see you in the next video.